All of you want to repeal and replace Obamacare, so let's talk about your plans, specific plans to replace it. I want to bring in our chief political correspondent, Dana Bash.
Senator Rubio, you said yesterday right here in Houston that Mr. Trump thinks part of Obamacare is pretty good. So he says he is going to repeal Obamacare. Are you saying that you're worried he won't?
He said he likes the individual mandate portion of it, which I don't believe him, that should be part of it. That should not remain there. I think here's what we need to replace it with. We need to repeal Obamacare completely and replace it with a system that puts Americans in charge of their health care money again. If your employer wants to buy health insurance for you, they can continue to do so from any company in America they want to buy it from. Otherwise, your employers can provide you health care money, tax-free, not treated as income, and you can use that money only for health care, but you can use it to fund health care any way you want. Fully fund a health savings account, the combination of a health savings account or a private plan from any company in any state in the country. And if you don't have that, then you will have a refundable tax credit that provides you health care money to buy your own health care coverage. And that, I think, is a much better approach than Obamacare, which, by the way, isn't just bad for health care, it's bad for our economy. It is a health care law that is basically forcing companies to lay people off, cut people's hours, move people to part-time. It is not just a bad health care law, it is a job-killing law, and I will repeal it as president, and we will replace it with something substantially better for all Americans.
Mr. Trump, Senator Rubio just said that you support the individual mandate. Could you respond?
I just want to say I agree with that 100%, except pre-existing condition. I would absolutely get rid of Obamacare. We're going to have something much better. But pre-existing conditions, when I'm referring to that, and I was referring to that very strongly on the show with Anderson Cooper, I want to keep pre-existing condition. I think we need it. I think it's a modern age, and I think we have to have it.
Okay, so let's talk about pre-existing conditions. What the insurance companies say is that the only way that they can cover people is to have a mandate requiring everybody purchase health insurance. Are they wrong?
I think they're wrong 100%. What we need, look, the insurance companies take care of the politicians. The insurance companies get what they want. We should have gotten rid of the lines around each state so we can have real competition. We thought that was gone. We thought those lines were going to be gone, and something happened at the last moment where Obamacare got approved, and all of that was thrown out the window. The reason is some of the people in the audience are insurance people and insurance lobbyists and special interests. I'm not going to point to these gentlemen. Of course, they're part of the problem, other than Ben, in all fairness. And actually the governor, too. Let's just talk about these two, okay? Because I don't think the governor had too much to do with this. But we should have gotten rid of the borders. We should have gotten rid of the lines around the state so there's great competition. The insurance companies are making a fortune on every single thing they do. I'm self-funding my campaign. I'm the only one in either party self-funding my campaign. I'm going to do what's right. We have to get rid of the lines around the states so that there's serious competition.
But Mr.
And you're going to see, excuse me, then you're going to see pre-existing conditions and everything else be part of it, but the price will be down, and the insurance companies can pay. Right now, they're making a fortune.
But just to be specific here, what you're saying is getting rid of the barriers between states, that is going to solve the problem?
That's going to solve a lot of the problem. And the insurance companies are going to say that. They want to keep it. They say whatever they have to say to keep it the way it is. I know the insurance companies. They're friends of mine. The top guys, they're friends of mine. I shouldn't tell you guys. You'll say it's terrible. I have a conflict of interest. They're friends of mine. There's some right in the audience. One of them was just waving to me. He was laughing and smiling. He's not laughing so much anymore. Hi. But you know what? The insurance companies are making an absolute fortune. Yes, they will keep pre-existing conditions, and that would be a great thing. Get rid of Obamacare. We'll come up with new plans, but we should keep pre-existing conditions.
And I was mentioned in his response, so if I may, about the insurance companies. You may not be aware of this, Donald, because you don't follow this stuff very closely, but here's what happened. When they passed Obamacare, they put a bailout fund in Obamacare. All these lobbyists you keep talking about, they put a bailout fund in the law that would allow public money to be used, taxpayer money, to bail out companies when they lost money. And we led the effort and wiped out that bailout fund. The insurance companies are not in favor of me. They hate that. They're suing now to get that bailout money put back in. Here's what you didn't hear in that answer, and this is important, guys. This is an important thing. What is your plan? I understand the lines around the state, whatever that means. This is not a game where you draw maps around.
And you don't know what it means.
What is your plan?
That's the problem.
What is your plan on health care? You don't have a plan.
The biggest problem he doesn't know.
The
biggest problem he's got is he doesn't know. You know, I watched him melt down 2 weeks ago with Chris Christie. I got to tell you, the biggest problem he's got is he really doesn't know about the lines. The biggest thing we've got, and the reason we have no competition, is because we have lines around the state, and you have essentially
we already mentioned that as part of my plan. I know what that is. But what else is part of your plan? So your only thing is to get rid of the lines around the states. What else is part of your health care plan?
What the lines around the states mean.
That's your only
plan. And it was
plan.
almost done. No. You know
All
what
right,
that does?
I'll
That
give him
brings
time
in,
to mind. He can tell us his plan.
Excuse me. That
What's your
brings
plan?
in competition. When you get rid of the lines, it brings in competition. So instead of having one insurance company taking care of New York or Texas, you'll have many. They'll compete, and it'll be a beautiful thing.
Right. And so that's the only part of the plan? Just the lines, the interstate competition?
No, the nice part about the plan, you have many different plans. You'll have competition. You'll have so many different plans.
But now he's repeating himself.
No, I'm not repeating. No. Repeat myself.
You don't repeat yourself.
Here's the guy who repeats himself.
You repeat yourself every day.
I watched him, talking about repeating, I watched him repeat himself 5 times 4 weeks ago. And
I saw you repeat yourself 5 times 5 seconds ago.
I watched him melt down on the stage like I've never seen anybody. I thought he came out of the swimming pool.
I said, well,
let's talk about your
himself
plan.
every night. It says 5 things. Everyone's dumb.
Senator
He's going to
Rubio.
make America great
Senator
again.
Rubio.
We're going to win.
Senator
He's
Rubio,
winning in the
please.
polls.
Please
And the lines around the state. Every night. Same thing.
Senator Rubio.
I tell the truth.
Senator Rubio, you will have time to respond if you would just let Mr. Trump respond to what you
he's
just
gonna give us
posed
his
to
plan
him.
now, right?
If you could talk a little bit more about your plan. I know you talked about
No,
the
we're going to
interstate.
have many different plans
you
because
give
there's going to be
specific?
competition.
Said it again.
There's going to be competition. There is going to be competition among all of the states and the insurance companies. They're going to have many, many different plans.
Is there anything else you would like to add to that? as part of
No,
your
there's
plan?
nothing to add. What's to add? What is to add?
Thank you both.
All right.
Governor Kasich, you've said it is, quote, un-American to deny someone health insurance if they have a pre-existing condition. Would you leave the individual mandate in place, requiring all Americans to purchase insurance?
No, I wouldn't. But that doesn't matter when it comes to the issue of pre-existing conditions. You don't want any American to lose their house, everything they've saved, because they get sick. Now, I think it is more complicated than what we've heard here tonight. We're actually running significant health reform in my state. I would repeal Obamacare for a variety of reasons. I would take some of the federal resources, combine it with a freed-up Medicaid program, which I would send back to the states, and cover the people who are currently the working poor, because we don't want to have tens of millions of Americans losing their health insurance. And then we're driving towards total transparency. If any of you here ever get a hospital bill, it's easier to interpret the Dead Sea Scrolls than to understand your hospital bill. The fact is, what we need is transparency with hospitals and with the providers. And I'll tell you what we will do. We are actually going to make payments to physicians and to hospitals who actually deliver health care with great quality at low prices. We're actually going to make the market work.
Governor, let me just go back to the original question about the individual mandate. In 1994, when you were in Congress, you proposed a plan requiring an individual mandate. So what changed?
Well, Dana, the Heritage Foundation had this position as well. And when I look at it, I don't think it's tenable. And we don't need to do that. Again, I'm telling you that we have a proposal, a plan that we're enacting now that says if you are a hospital or a doctor and you're providing very high quality at lower prices below the midpoint, some charge high, some charge low. If you are below the midpoint, we are going to give you a financial reward for allowing you to provide services that result in high quality for our people at lower prices. That is the way in which we are going to damp down the rising costs of health care. Because if you think about your own deductibles today, they're going higher, higher, and higher. And you know what? At some point, people can't afford it. Our plan will work. It uses the market. It uses transparency. It gets the patient in the middle. And guess what? We're actually doing it in my state, the 7th largest state in the country. And if this will go national, we will get our hands on health care where you will know what's going on. We will pay for quality, lower prices, and we will begin to see health care become affordable in America, and where people will also be able to have health insurance even if they have a pre-existing condition. We don't want to throw millions of people out into the cold and not have the health insurance, Dana. So that's really what we're doing. This is not a theory. This is what we are actually doing in our state. We will begin payments next year based on episodes that we have in our lives. If our primary care physicians keep us healthy for a year with really high quality, guess what? They will get a financial reward. Our primary care physicians need help. They need support. We're losing them. This will allow them to get a reward for doing
Governor
a great
Kasich,
job.
thank you.
Thank you.
Dr. Carson. Dr. Carson, you have dealt with the sickest of patients. You support covering pre-existing conditions. How would you change Obamacare but maintain that coverage?
Well, first of all, health care is not a right, but I do believe it is a responsibility for a responsible society, and we are that. We spend almost twice as much per capita on health care as many other nations who have actually much better access than we do. I propose a system in which we use health empowerment accounts, which are like a health savings account with no bureaucrats. And we give it to everybody from birth until death. They can pass it on when they die. We pay for it with the same dollars that we pay for traditional health care with. We give people the ability to shift money within their health empowerment account within their family. So if dad's $500 short, mom can give it to him, or cousin or uncle. And it makes every family their own insurance carrier with no middleman. Gives you enormous flexibility. And also, you know, if Uncle Joe is smoking like a chimney, everybody's going to hide his cigarettes because they're all interested in what's going on there. And also, your catastrophic health care is going to cost a lot less money now because the only thing coming out of that is catastrophic health care. So it's like a homeowner's policy with a large deductible versus a homeowner's policy where you want every scratch covered. One costs $1,500 a year, one costs $10,000 a year. You can buy the $1,500 one. That will take care of 75% of the people. The people who are indigent, how do we take care of them now? Medicaid. What's the Medicaid budget? Almost $500 billion. Almost 80 million people participate, which is way too many, and that'll get a lot better when we fix the economy, which I hope we get a chance to talk about. But do the math, over $5,000 for each man, woman, and child, and they will have a lot more flexibility. What could you buy with that? A concierge practice.
Thank you.
You could still have thousands of dollars left over. And let me just finish, because I don't get to talk that much. And, you know, you have the money that's left over to buy your catastrophic insurance, but most importantly, we give them a menu just like we do on Medicare Part C, and they have the choices that will allow them not only to have catastrophic health care, but drug care and everything else. It will be such a good program that nobody will want Obamacare after that, and that's probably the best way to do it, although if anybody still did, I would still defund it.
Thank you. Thank you, Dr. Carson. Let's talk about the economy. Let's talk about the economy.
Wolf, does everyone get to address Obamacare but me?
I want to move on, but there'll be plenty of opportunities for you to address.
It's kind of an issue I have a long history with.
I know you do it. And all right, go ahead.
Thank you, Wolf.
How do you get that extra time, Cruz? You're very good at.
You know, this is
holding
another
it up.
issue on which Donald and I have sharp disagreements. On Planned Parenthood, he thinks Planned Parenthood is wonderful. I would instruct the Department of Justice to investigate them and prosecute any and all criminal violations. On Obamacare, both Donald and I say we want to end it, but for very different reasons. I want to end it because it goes too far, it's killed millions of jobs, and it's hurting people's health care. Donald wants to end it because he says it doesn't go nearly far enough. And what was amazing in that exchange that was missing is for decades, Donald has been advocating socialized medicine. What he said is the government should pay for everyone's health care. And in fact, a couple debates ago, he said, if you don't support socialized health care, you're heartless. Now, liberal Democrats have been saying that for years. Now, let me tell you, if you're a small business owner, Donald Trump's socialized medicine, putting the government in charge of your health care, would kill more jobs than Obamacare. And if you're elderly, the results of socialized medicine in every country on earth where it's been implemented has been rationing, has been the government saying, no, you don't get that hip replacement, you don't get that knee replacement. The government is in charge of your health care. I'll tell you this, as president,
Senator,
I will repeal every word of Obamacare.
Thank you. Mr. Trump.
I do not want socialized medicine, just so you understand. He goes around saying, oh, he wants it. I do not want socialized medicine. I do agree with him that it's going to be a disaster, Obamacare, for the economy. in 2017, it's going to be impossible for us to pay for it if you look at what's going on. That's why it has to be repealed for a lot of reasons. Number one, it doesn't work. Number two, premiums, you look at premiums going up 25, 35, even 45% and more. We have to get rid of Obamacare. It is going to destroy our economy completely. Our economy is not doing well. It is going to destroy our economy greatly. And on that, I agree.
Donald, true or false, you've said the government should pay for everyone's health care.
That's false.
You've never said that.
No, I never. I said it worked in a couple of countries, but
you've never stood on this debate stage and says it works great in Canada and Scotland, we should do it here. Did you say if you want people to die on the streets, if you don't support socialized health care, you have no heart?
I will
Did you
not
say
let
you're a
people
liberal
die
on
on the
health
streets
care?
if I'm president.
Have you said you're a liberal on health care?
Excuse me, let me talk.
Talk away.
People,
explain your plan, please.
My plan is very simple. I will not. We're going to have private. We're going to have private health care, but I will not allow people to die on the sidewalks and the streets of our country if I'm president. You may let it, and you may be fine with it.
So does the government pay for everyone's health care?
We are going to take
yes
those
or
people
no?
and
just
they're going
answer
to
the question.
Excuse me. We are going to take those people, and those people are going to be serviced by doctors and hospitals. We're going to make great deals on it, but we're not going to let them die in the streets.
Who pays for it?
Can I
Who
just
controls?
clarify something?
Senator, gentlemen,
Well,
gentlemen,
no, I
please.
want to clarify something.
Gentlemen,
this
please,
is a
I want to
Republican
move on.
debate, right?
I want to talk
because
about
that attack
the
about
economy.
letting people die on the
want-
streets
This is
of the
a critical
government doesn't
answer. He
support
should
health
answer.
care.
The government would pay
Gentlemen,
for it.
all of you have
refusing
agreed.
to answer that
Call it
question.
Senator
what you
Cruz.
want. You know what? Call it what you want.
It's a yes or no.
Call it what you want. People are not going to be dying
All
on the
of you have
sidewalks of the
agreed.
street.
All of you have agreed to the rules.
Call it whatever
I
you
want to
want.
move on. We're talking about the economy right now. Mr.